Welcome back. From dealing with long-lasting grief to understanding if you have an addiction. It is Therapy Thursday, a weekly segment where we answer your mental health questions. And back with us once again is Dr. Brenda Lloyd Jones from the University of Oklahoma. And as always, we're so happy to see you today, Brenda.
Thank you. It's my pleasure to be here.
And we have two great viewer questions for you today, so we want to jump right into the first one. It's from Tanisha. She says, I still feel grief and cry 4 years after my mother died. After she passed, I took part in a group therapy program. I'm trying to move forward with my life as my mom instructed me to do. Is it normal that I feel sad over and over again?
Yeah, you know, I want Tanisha to know that it is not abnormal to cry tears of sadness years after her mother has passed. In fact, it's quite normal. Grief is so personal and deeply individual. So what I would certainly suggest is for her to be aware of waves of grief. They can trigger us. For example, she can see a picture of her mother and feel sad. She can frequent a restaurant, for example, that they both attended together or visited together and feel sad. And so I would suggest that Tanisha think about going back or even finding a new group therapy program so that she can learn updated information as well as new techniques. She can also schedule a private visit with a professional mental health person, and in that way she can talk about her specific concerns. Here's the heart of the matter. She is feeling symptoms of sadness, and certainly the physical absence of her mother is palpable. And what she can continue to do is fill that void with precious memories and special experiences.
And someone that close to you, it's something you're never really going to get over, too.
You know, I say you never get over it. You learn to walk through it. Absolutely.
Good advice, Brenda. And then we have a question from Thomas as well. He says, I think I have a gambling problem. After eating dinner or attending an event, I drop my family off and head to the casino. I used to go once a week, but now I go 3 or 4 times a week. I have a stressful job and I make good money. That's how I justify my behavior. How can I tell if I need professional help?
This is also an important question. You know, did you know that the American Psychiatric Association defines gambling addiction as a mental health disorder? And some signs of signs of gambling addiction, as Thomas asked, is number one, you have an urgent need to go more often to gamble, as well as spend more money. You are preoccupied with gambling, and you use it as a way to cope with stress. I have some suggestions for Thomas. Number one, he can spend more time with his family. Ask them and invite them to play some games or watch a movie while they put together a puzzle. Here, the goal is to shift the desire to go to the casino with family fun time. Also, he can think about joining a support group like Gamblers Anonymous. It follows the 12-step program similar to Alcoholics Anonymous. Here's the heart of the matter. He has identified his concern, and so he needs to move with that and begin to get assistance and help before things get deeper and he gets more involved.
All right, good advice as always, Brenda. Good to see you again.
Thank you.
Be right back after this break. Stick with us.